In the last 20 years, the family pet evolved into an integral part of our families. So when your pet isn't feeling well or having recurring symptoms, you want to help them and get to the root of the problem. Dogs and cats, just like humans, can have allergies. In fact, more than 30% of all skin irritations can be attributed to allergies. First, we should discuss what are allergies. In its most basic form, an allergy is the body's misidentification of something with which it comes into contact. When we inhale, ingest, or our skin is exposed to pollens, our body sometimes sees these pollens as a threat. When the number or amount of allergens become too great for the body to contain, allergic reactions can occur. Some symptoms of allergies are licking, chewing, sneezing, itching, redness, vomiting, diarrhea, wheezing, coughing, or lethargy. Allergens are cumulative in their effect on animals, meaning the more allergens it's exposed and has sensitization to, the more likely the chance of allergy-like symptoms. A symptom's onset is not necessarily an indication to what the animal is allergic. For instance, an animal with food and inhalant allergies may only show symptoms in the summer, when the pollen count is at its highest, because pollen and food allergens together push it over the threshold or breaking point.
What should I do if I think my pet might have allergies?
Make an appointment to review the situation with your veterinarian. Make the doctor aware of any patterns you've noticed in their symptoms, where the symptoms occurred, and any potential correlation to new symptoms and environmental changes. Taking your pet to their vet to first rule out other possible reasons for the symptoms is very important. The symptoms we discussed can also be a sign that something more serious might be occurring, and we want to rule that out first. The best way to do this is to allow your veterinarian to conduct a full examination, including blood and stool samples if necessary. Any coughing, sneezing, excessive itching, or licking should be reported to your vet to assist them in determining the possible culprit. Once other potential illnesses have been ruled out, your vet should recognize if allergies are at the root of your pet's problem and can advise if allergy testing is right for your situation.
Is this the best way to test?
Yes, and unlike skin testing, there is only minimal discomfort for your patient and no need to refer them out to someone else. Instead of a 4 to 6 week withdrawal period from steroids or antihistamines, putting the animal under anesthesia, shaving them, injecting them with the allergens, and waiting for a reaction to appear, all you need to do is a simple blood draw and send it to our labs via FedEx. We are guaranteed to receive the sample within 2 business days, and will have the results out to your vet shortly thereafter. Once the package arrives at Spectrum, everything must be opened and contents inspected for accuracy. They are then put into the computer exactly as the paperwork states. From there, all samples go down to the lab for testing. Before we get started in the lab, we review the paperwork again to ensure accuracy. With approximately 18 hours of incubation time and a time frame to get the results out within 48 hours, there isn't a whole lot of cushion. Fortunately, with our almost 20 years of experience, we have this process down to a science. We have just enough time to make the plates, run the appropriate panels, and get the results back to our quality control department, who review each and every booklet before they go out. The booklets are then inserted and posted, and in most cases go out the same business day. Once your pet's booklet goes out, your veterinary clinic typically receives it within 3 to 5 business days. Unlike the basic industry standard, Spectrum Labs provides you, the owner, not just a faxed copy of the results, but a complete results booklet customized specifically for your pet. We color code all of the results to make it easy for both veterinarian and pet owner alike to decipher the results. Red is positive, and yellow means borderline reaction has occurred. If you choose our most comprehensive or food panels, you'll also receive a list of commercial pet foods suitable for your pet that do not include any of the offending allergens to which they have reacted. Included in this list are dry and canned foods, as well as frozen foods and treats. This entire booklet is dedicated to helping you better understand allergies and how you can reduce the amount of allergens in your pet's environment, without feeling like you have to get rid of the couch or rip up the carpet. And treatment options available to you that can further reduce or eliminate their symptoms. If a dietary change and some cleaning suggestions don't rid your pet of their symptoms, we also provide an all-natural allergen therapy derived from purified plant and pollen extracts in the form of easy-to-administer injections in lieu of daily or monthly steroid injections. Once your pet's treatment has been ordered, we're working hard to get the order filled and out the door. Your pet's safety and adhering to the highest USDA standards are at the forefront of all that we do in our lab. Therefore, all treatment sets are made in a sterile environment. Once made, our treatment sets are checked to ensure that all vials are properly sealed, free of particulates, and that all instructions are present and clear for your convenience. The allergens are then shipped via FedEx to arrive at the clinic in a timely fashion. Once the clinic receives the treatment, we ask that they refrigerate the treatment in order to make every effort in keeping the allergens fresh and in an environment where they will not break down prematurely. For your convenience, we have a place on our website where you can get a customized treatment calendar specifically for your pet. Simply input your pet's name and the date of the first injection, and once the PDF image pops up, hit print. There is also a spread in your treatment diary where this information can be stapled or taped into place for future reference. Here at Spectrum Labs, we want to provide you with the information about the injections so that you can understand our goals and how this is a viable and truly safe all-natural alternative to steroid use. Therefore, we encourage you to read through your treatment diary and the importance of your role, especially if you're going to be the person administering the treatment sets and taking notes after each injection. This is also the information we need should the animal have an increase in symptoms during the initial treatment. Adherence to the schedule is also very important. If you miss an injection within a few days either way, go ahead and administer the next injection. If it has been several weeks or months since the last injection, it is best to consult with your veterinarian with the following information: the date of the last injection, dosage amount and color of vial, reason for stopping, and if any symptoms were noticed prior to stopping within 24 to 48 hours of the injection. Also, should you choose to administer the treatment at home, we ask that the treatment sets remain in the refrigerator until the time you are ready to administer the injection. Each injection should be brought to room temperature before administering. Make sure that you give the injection at a time when you will be able to observe your pet for 45 minutes to an hour. While reactions are very rare, they can occur, and if so, will usually be within 1 hour of giving the injection. Most common reactions involved increased itching and/or redness, and on very rare occasions, animals may develop symptoms such as hives, vomiting, diarrhea, or lethargy. If there is an increase in symptoms, this isn't necessarily a bad thing. Please contact your veterinarian and again advise them of the symptoms, the date of the last injection, the dosage amount and color of vial, and how soon after the injection the increase in symptoms occurred.
When should I see improvement?
Unlike previous medications that you may have used for your pet's allergies, hyposensitization is a long-term process. You and your veterinarian have elected to go this route because of its effectiveness, safety, and absence of harmful side effects. A little patience during the process will be rewarded with a happy and healthy pet. You can usually expect to see some improvement within 3 to 5 months, which again will vary from animal to animal. Some animals show response a lot earlier, and yet others take longer to reach the same endpoint. Do not become discouraged if your animal takes longer to respond. If your animal has yet to respond after the first 9 months of treatment, you will want to discuss continuing and/or other alternatives with your veterinarian. With today's advancement in medicine, allergies, whether they are in people or pets, don't have to cause you to miss out on the things you love. Thank you for taking the time to learn about how we put 20 years of allergy expertise to work for you. Our end goal is to improve the quality of life for your beloved pet. And thank you for trusting Spectrum Labs as your allergy testing and treatment source.